Today we're going to talk about something so important that it plagues 80% of American adults during their lifetime. And 31 million Americans struggle with it daily. It's the leading cause of disability worldwide, and 50% of the American workforce struggles with it every single year. If you are already one of the 31 million Americans dealing with low back pain right now, I'm going to teach you how you can dramatically improve it and heal from it naturally and safely. If you're one of the lucky ones that isn't dealing with low back pain or other spinal problems right now, then I'll teach you how to prevent it. And for all of you, there's a really good chance your mom, your dad, your grandma, your grandpa, or someone else very close to you is experiencing life-altering spinal pain. So be sure to listen very carefully and pass this podcast on to those you care about that need to hear this message. Welcome to the Foundational Health Podcast, where we provide education and inspiration to help guide you on your journey to look better, feel better, and most importantly, heal better. Hello, and welcome to the Foundational Health Podcast. I'm Dr. Kevin Schultz, and today we are going to talk about low back pain, but also neck pain and spinal pain in general. Today is by no means meant to be an exhaustive discussion on spinal pain because that would take several hours. So my goal today is to give you a very simple, basic, but incredibly important understanding of what causes spinal pain and how to avoid it if you don't have it already, and then reduce it if you're dealing with it right now, and then most importantly, how to heal from it. So to start the discussion, we have to talk about the spine. The spine really has three primary functions. Number one would just be support, keeping us upright. So we've got muscles attached to the spine, and that allows us to stand upright, sit upright. And then number two would be movement. Because there's muscles attached to the spine, because there are spinal discs and ligaments and tendons and all of those things, it allows for flexibility. So we can bend forward, bend backwards, sideways, rotation. It allows for support and movement. And then arguably, the third and most important aspect of the spine is it protects the spinal cord. So there is the spinal canal that runs all the way down your entire spine, and that is where the spinal cord runs, which leads me to the nervous system. So the nervous system controls everything that we are. Everything, it literally makes up every part of us as a human being, and yet the majority of people don't really understand the nervous system and how it works. The basics of that, which is really important for the discussion today, is that of course we have our brain, which sits in our skull, and then the brain turns into the brain stem down at the bottom. The brain stem actually exits a hole in the bottom of your skull, and it goes into the top couple of vertebrae. And then that brain stem literally turns into the spinal cord, which runs down that entire spinal canal, the length of the spine. And then the spinal cord exits the spine at every single level through spinal nerves. And those spinal nerves travel to every cell, organ, tissue, muscle in our entire body to control everything that we do and who we are. So there's two different types of control, really. You have, through the nervous system, you have brain to body, and I think that's what the majority of people think of. We talk about all the time the brain-body connection, but there's also the body-to-brain connection. And that brain-to-body, body-to-brain connection really makes up our thoughts, our memory, our learning, our feelings, our movements, which balance, coordination, flexibility, all of those things happen through the nervous system. The body-to-brain aspect, as I mentioned, is the one that most people don't really put as much thought into. We think of our nervous system, our brain controlling our muscle movement and our organ function, but we don't think about the body-to-brain connection as much. And I'm going to give kind of an extreme example so you can just understand how that works. So it's not an extreme example to just understand how it works, but it's also an example that I think is just how fascinating the human body is at doing the right thing at the right time and always doing that in our favor. And that would be hypothermia. when we think about hypothermia, we think about the awful aspects of it, right? We get so cold that you can literally die from hypothermia, or you can get frostbite during hypothermia. Well, what's happening during that entire process? What is the body attempting to accomplish through that body to brain nervous system connection? So ultimately, you get cold, your fingers get cold, your toes get cold, you start to get cold overall, and your nervous system senses that. It sends a signal to the brain saying, hey, we need to do something here. The body's getting incredibly cold. As a result of that, what the brain then does is it will send blood to your vital organs to keep you alive, to preserve you. So it robs blood from things like fingertips and toes and limbs, which, yes, can result in frostbite and can result even in losing limbs, but it's doing that to protect you. So there's more blood flow to the vital organs to keep you alive. Your body starts to shiver, which is an increase in metabolism. It's another survival mechanism. You even get goosebumps. Goosebumps also part of the survival mechanism. It's raising your body hair to minimize heat loss. So that's the body to brain connection. And then the one that we think about more often, which is that brain body connection. And the brain body connection, primarily for the sake of today, we're just going to discuss muscles and organs. So muscles and organs are controlled by those spinal nerves from the brain, sending all those signals out of the brain, through the brainstem, down the spinal cord, and out the spinal nerves to every aspect of your body. And then that part of the nervous system is really broken up into two parts. You have the sympathetic part, which most commonly we think of as the fight or flight. And then you have the parasympathetic. So the sympathetic, that fight or flight part of the nervous system, is really contracting or speeding something up. And the sympathetic nervous system is really from the top part of your neck, right about here, all the way down to the bottom of your spine. And then there's the parasympathetic nervous system, which is way in the top. It's some of the cranial nerves up in that brainstem, and then the sacral nerves way down in your tailbone. The parasympathetic is the rest or digest, which is relaxing and slowing down parts of our body. So an example of that sympathetic parasympathetic balance, it's called, that balance in the nervous system. If we look at any organ in the body, we could use this same example. But let's look at the heart for a really good example of how this works. The balance is incredibly important. And I don't want you to take my word on this. One of the things that I encourage you to do, and I did before this podcast, is I Googled what happens to your heart if you have an imbalance in the sympathetic versus the parasympathetic nervous system control. You can do this yourself. You can Google that. You can Google what happens to the digestive system, what happens to my liver. Here's what Google says. If there is an imbalance in the sympathetic and parasympathetic nervous system control, your heart rate can become abnormally fast or abnormally slow, depending on which system is dominant, potentially leading to symptoms like palpitations, dizziness, or difficulty exercising, as the sympathetic system speeds up the heart while the parasympathetic system slows it down. An imbalance can disrupt this crucial regulation. So the reason that I Googled that, the reason that I'm trying to get this point across to you, is to get across the point that your spine is incredibly important. Again, that primary function of the spine, besides motion and support, is to protect your nervous system, to protect that body-brain and brain-body control. And we know from countless scientific studies that the healthier your spine is, the healthier your nervous system is. The less tension there's going to be on your nervous system, so you have a better chance of good brain-body connection and really good balance in the nervous system between the parasympathetic and the sympathetic control. And if we simplify that extremely, then if you think of parasympathetic, sympathetic, it's literally heart, contract, relax, digestive system, contract, relax, contract, relax. That's all happening through that control. And you can imagine if the balance of contract, relax is off in your heart, in your digestive system, it leads to consequences depending on how bad that balance is, either short-term consequences or long-term consequences. This all leads to a very important question. Can an unhealthy spine affect your organs? Can it cause disease in the organs? Can it cause disease overall in the body? So at the University of Pennsylvania, a man named Dr. Henry Windsor, he was an MD, he conducted an experiment based on both chiropractors and then osteopathic MDs who also manipulate the spine and work with the spine historically. They had claims that they would say that, hey, when we adjust or manipulate vertebrae, our patients get rid of stomach problems or they improve. There was reports of ulcers improving and menstrual cramps and thyroid conditions, even constipation, heart disease, and all of these different things. So he did this experiment where he dissected both human and animal cadavers to see if there really was a relationship between any diseased organs discovered during the autopsy and the vertebrae and nerves that controlled those organs. This is just simple anatomy. We know that, for instance, the sympathetic control of the heart comes from right up here in the upper back area primarily, and the parasympathetic control is up in the brainstem, and every organ in the body has that. We know the nerves that control those organs. So what he did was he dissected 75 human and 72 cat cadavers, and he found nearly a 100% correlation between minor curvatures of the vertebrae and diseases of the internal organs. Heart disease. All 20 cases of heart disease that were discovered, they found that there was misalignments in the upper 5 thoracic vertebrae. With lung disease, all 26 cases of lung disease, there was a direct connection, again, between upper back vertebrae. With stomach disease, 9 cases, direct correlation 100% of the time between the mid-back area, between the shoulder blades. And then with liver disease, same thing, same area of the spine, 13 for 13, liver disease, misalignments. Kidney disease, all 17 cases with kidney disease, there was alignments in the lower thoracic spine, which is more right in this area here. So I'm not going through all of this to scare anybody or tell you that, oh my gosh, if you have a minor misalignment in your spine, you're going to die from a certain condition, but rather just to explain the incredible importance of the nervous system, that connection between our brain and body and our brain, and therefore the incredible importance of keeping our spine healthy. So let's talk about spinal misalignments. What causes a spinal misalignment? So if they're that big of a deal, we should probably know what causes them, how we can prevent them, and how we can improve it, right? So the main causes we know start right at birth. Depending on, obviously, if you have a normal birth, that's not very traumatic. But birth trauma is a primary cause, especially if it's a really difficult birth or if they had to, God forbid, use forceps or suction cup, or actually one of the most traumatic births, which is a shock to the majority of people, is when they have to do a C-section because they're removing the baby typically by the head and lifting straight up on the head. So that is where the first spinal misalignments occur in the large majority of people. And then you have slips and falls. If you live in Wisconsin, right now we've got our first snowfall of the year and there's ice on the sidewalks and the driveways. So slips and falls are a very, very common thing this time of year. But any type of slip and fall, accidents, whether it's a car accident or a work accident or any other, can cause spinal misalignments. Sprain and strain muscle injuries, whether it happens at work, at home, in the gym, these sprain and strain injuries cause misalignments in the spine because those muscles are connected to the spinal bones. Poor posture, especially in this day and age with things like this, our laptops, tablets that kids are using at an early age in school. Cell phone posture is actually the #1 culprit. We're going to talk about some of this as we go on and ways that you can improve that. We know that weak muscles in general, whether it's postural muscles or other weak muscles, create spinal misalignments. And then what does a spinal misalignment rather create? So spinal misalignments, really this list could be endless. We'll talk about some of the most important ones. When the spine is not aligned properly, there's going to be a loss of motion. And this is really pretty basic. So I use the example all the time of, if you imagine walking on a knee that's twisted out of normal position, do you think that that's going to create some loss of normal joint motion? And the answer, of course, would be yes. We could say that with any joint in the body. And then what happens with that loss of motion? Well, we know with a loss of proper motion, you automatically are going to have tighter muscles. And we know that tight muscles over time become weak muscles. So there's going to be tighter muscles, there's going to be weak muscles connected to that joint. The ligaments and the tendons actually get tighter and weaker, and then it ultimately affects the spinal disc, that cushion between every single one of your vertebrae that allows for all the flexibility and the motion in there. We also know that you have decreased nerve flow. As we hit on earlier, that's incredibly important. That decreased nerve flow happens from spinal tension along with a number of different things, but it also affects the flow of three other very important things, and that would be something called blood flow. We know that when muscles tighten up, it reduces blood flow to the body. And if you're reducing blood flow, you're reducing nutrients and oxygen getting to tissues. That's the primary purpose of blood flow to an area in the body. You reduce lymphatic flow. And then CSF, which is something that is a lot less known, but CSF stands for cerebrospinal fluid. And we've known this forever, that our brain floats in this fluid called CSF. But what also happens is this CSF flows from your brain out that hole in the bottom of your skull, all the way down your spine to the tailbone and back up. There's this constant flow of CSF, and that CSF provides proteins and other nutrients to keep your spinal cord healthy. So when you're interfering and decreasing nerve flow, CSF flow, blood flow, and lymphatic flow, you're dramatically affecting the health of the body. So it doesn't all just happen through that decreased nerve flow alone. One of the things that I'm really going to talk about a lot today and hit on is how the spinal misalignment affects discs. Spinal misalignment creates disc degeneration. And the disc is incredibly important to the health of your spine. The disc provides cushion. So the cushion, literally, it's like a built-in shock absorber in between those vertebrae. It allows for that proper movement to take place in the spine, all of the flexibility, but then it also protects where the nerves exit. The more that a disc will decrease, it decreases the hole at the back of the spine where the nerves exit the spine, so there's a better chance for nerves to get pinched and irritated and rubbed on. And then, of course, if that disc gets unhealthy enough to the point where it's bulging, then you literally, if the bulge happens at the back of the spine, those nerves are getting pinched and irritated from a disc bulge. So how do we keep the discs healthy? That's really the big question, because we know that disc degeneration increases the chances of arthritis. Not the chances, it dramatically furthers the advancement of arthritis. And then we also know that disc degeneration, the worse that they get, that is one of the primary causes of spinal surgeries. It leads people to needing a spinal surgery when those discs degenerate entirely. So there's something called imbibition, and this doesn't just apply to spinal discs, it applies to multiple things in nature. And ultimately, when we're talking about imbibition of a spinal disc, it means fluid pumping in and out or moving in and out of a spinal disc. This should potentially be your number one takeaway, your aha moment, because it's incredibly important. The discs in your spine, as well as cartilage and other joints, are the only areas in the body, besides a small part of your eyes, that don't have a blood supply. They have no direct blood supply to them. So the spinal disc doesn't have any blood going into it. And if you remember, we just talked about the blood is there to provide oxygen to the tissues, to provide fluids to the tissues, to provide nutrients to keep it healthy. So how does a disc stay healthy without a blood supply? It does it through imbibition. It does it through movement of the spine. That movement of the spine pumps the disc. It pumps fluid in and out of the disc to supply it with all of the oxygen, the fluids, the nutrients to keep it healthy. Disc degeneration, therefore, is literally disc dehydration. I think we should rename it, because if people knew it was disc dehydration, maybe they would take more action and do more about it, because they would know that it is something that is controllable, instead of what most people believe and are told, which is disc degeneration and arthritis are just a normal part of the aging process. And certainly they advance, they're more prevalent with aging, but it is by no means a normal part of the aging process. Discs degenerate at a rapid pace when there's a lack of proper motion in the spine, because of what we just talked about, because the disc gets dehydrated. When a disc gets dehydrated, it dries out, of course. That's what dehydration is. The more dry it becomes, the more weak it becomes. The more weak it becomes, the more it shrinks, which is the degeneration part of it. And then the more weak it becomes, the more vulnerable it is to things like disc herniations, disc bulges, disc prolapses, disc ruptures for that matter. So we want to keep the discs hydrated. We want to keep them as healthy as possible, because we know that it leads to all the things that we talked about: the tight muscles, the weak muscles, pinched nerves, pain, organ malfunction, decreased energy, and then also, when we get into a really big one, things like sciatica. When people have disc problems, their prevalence of sciatica goes up dramatically. And if you don't know what sciatic nerve pain is, it's when you have pain, numbness, tingling, shooting down the back, the side, even the front of the leg. And all of those sciatic nerve branches exit the spine in your low back area. And then, this is not a technical term, I call it arm sciatica, just to help people understand it better. But when you have numbness, tingling, pain going down the shoulder, through the arm, numbness into the fingertips, it's really the same thing. The majority of the time, those things are coming from irritated nerves in the spine. All of the nerves in the lower to mid part of the neck are the ones that travel down into your arms and your fingers. And so when the discs are unhealthy, when they degenerate, when the spine isn't moving properly and muscles are tightening up, you're going to have a much greater prevalence of arm, leg, sciatica, pinched nerves, irritated nerves. Okay, so let's talk about how to avoid spinal pain and other spinal problems, and just to keep your spine healthy overall. What are the things that you can do? I'm a chiropractor, therefore I strongly believe in chiropractic care. I can tell you that, of course, there is a bias that comes with being a chiropractor for 25 years now and treating patients on a regular basis in my office for those 25 years. But that bias comes from the amazing things that I've seen. If you don't want to take my word for it and my bias, let's look at some incredible studies. So there was a study that analyzed 115 million patient records. The cool thing about studies nowadays is that with electronic health records, we have the ability to look at a lot more people in a short period of time. So this study looked at 115 million patient records. And what they did is they looked at patients that had low back pain, low back problems, disc problems, and then those patients that had that were under chiropractic care. Well, here's two of the amazing things that they found with those patients. The patients that were experiencing spinal problems, low back problems, and had chiropractic care as a result of that, they had a 68% reduction in the use of painkillers, of opioids, those strongly addictive opioid painkillers. 68% reduction in the use of those. They had a 45% reduction in repeat low back surgeries for people that already had one. So that's worth repeating. People that already had low back surgery, when they sought out chiropractic care, there was a 45% reduction in those people needing a repeat surgery. That's a really big thing. So here's a little extra incentive for you to want to avoid surgeries, because I think we can all agree that if you can avoid a surgery, you want to, right? So we know that keeping your spine healthy in general, and some of the things that I'm going to go over with you here, along with chiropractic care, can be fantastic for avoiding a surgery in the first place. But then another reason you want to avoid surgeries is because they have a very high failure rate. So this isn't looking at the rates of things that could happen or could go wrong with a surgery, but rather, according to the medical literature, what are the failure rates? Well, we know with the most simple of spinal surgery, something called a discectomy. So that would be like you've got a disc bulge, it's hitting a nerve, you've got severe sciatic pain. They're going to go in there and shave off part of that nerve. We know that that discectomy, shaving off part of the nerve, has a 19 to 25% failure rate overall, according to the literature. We know that with the first fusion of the spine, there is a 50% failure rate. So let me stop for a second and talk about failure rates. In the literature, often the failure rate is not just like the person came out of surgery and they weren't better. It's looking at the outcome of that surgery 1 year post-op or post-operation. 1 year post-operation, it's considered a failure if that person had the same or an increase in their pain. So it's not even considered a failure if you had low back pain and then a year later you're like, my low back pain's 10% better. That's considered a success. So a failure would be if the pain is the same or worse 1 year later. Well, 50% of the time that is true with a spinal fusion surgery. Sadly, when people have a spinal fusion surgery, of course, you can't fuse two areas of the spine without affecting motion. And all of the things that we've talked about today, hopefully you have an understanding of how important spinal motion is. Well, now if you affect motion in the vertebrae above or below or both from that spinal fusion, you're going to cause faster, early onset disc degeneration and other things that go wrong with the vertebrae and the discs above and below. Because of that, when they go back in and they say like, hey, we didn't have good success with that first fusion, so let's do a second one. Well, now the failure rate is 70%. They often go back in and do it a third time. I've had countless patients that have had this. Now, after the third fusion, an 85% failure rate. After the fourth fusion, there's a 95% failure rate. So I don't just look at chiropractic and physical therapy and acupuncture and massage and all of these other things, stretching on your own, which we're going to talk a lot about today, nutrition. I don't just look at those as like, hey, I just prefer natural things over medical things. I'm looking at what does the literature show? Where is your success going to be, not only for the short term, but for the long term, for your quality of life, for your longevity? Those are the things that are important to me. Because of that, that's why I want to help you to avoid spinal surgery. For those of you that haven't sought out a chiropractor and are looking for one, I also have some bias here because of the way that I practice based on my beliefs. But I am a strong believer that if you're seeking out a chiropractor, for me personally, I want to know what somebody's spine looks like. I'm not going to take a guess what their spine looks like, so I do x-rays. So I think it's important. You might not, and many chiropractors would disagree with this, but looking at x-rays is going to allow a chiropractor to be safer with areas that might have severe degeneration or severe arthritis. It allows them to be more specific where they see those spinal curvature, those spinal misalignments. So I think x-rays are a huge thing. And then also, you don't just have bones in your spine. You have bones in your spine that have muscles and ligaments and tendons and other soft tissue. So I think doing therapies both in office and at home are incredibly important. So if those things are important to you, the things that you should look for in a chiropractor is somebody who takes x-rays, and then somebody who does in-office therapies, or at a bare minimum does at-home therapies or prescribes and gives you at-home therapies based on your condition, based on what your x-rays show. There's also things that you want to avoid that can cause spinal problems over time. So let's talk about some of those. We know that some of the big culprits, and one of the biggest, is a bad mattress. So this is the question I get in the office all the time. What kind of mattress should I use? Is my mattress too firm? Is it too soft? What should I look for? So there's no perfect answer on this, but what I always recommend is that you're making sure that your mattress is firm enough that it supports you, yet not too soft that it's not supporting you. So you don't want it to be too firm that you literally aren't sinking in at all, because you want some support there, but you don't want it to be too soft where you're just sinking in, and that can be a huge culprit for low back pain. And it's why so many people wake up in the morning and they have miserable low back or neck pain, because they sink into their mattress way too much, or their mattress doesn't allow them to sink in at all and allow for some support. I'm a huge fan of the BioPosture mattresses. We have these listed on our website, foundationalhealth365.com. BioPostures you can read about, and actually we're going to put a link in the show notes to one of the reasons that I'm a huge fan of BioPosture mattresses. They have something that I haven't seen in any other mattress company, which is called sealant technology. And ultimately, this sealant technology that's in the covering of the mattress, that allows for increases of blood flow in your body, increased oxygenation to tissues, including your spinal tissues, up to 7%. And if you know anything about increased oxygenation of tissues, that's a really, really big deal. So that sealant technology does more than that. It's pretty incredible if you read about it. And then, of course, if you know me and you've followed me long enough, you know that I do everything I can and recommend anything that I can to avoid toxicity. And so the BioPosture mattresses are a fantastic mattress for all of those reasons. So check those on the website, see if it makes sense to you. Another thing that you want to avoid, we know that prolonged sitting can lead to just huge detrimental effects on your spine, and especially in your low back, but really all the way up your spine. With prolonged sitting in the last 10 years or so, it's become really common, even in mainstream literature, to hear them talking about sitting is the new smoking. And it's because of all of the awful effects it really has on your entire body, but it's really awful for your spine because of the lack of motion that takes place. It causes disc degeneration to progress really rapidly. And then poor posture, whether it's on a computer, just poor posture in general with a cell phone, that leads to weak muscles. We hear a lot also about lifting properly or avoiding lifting improperly. One of the things that gets overlooked with lifting, I find very often, is lifting and twisting. So this is the number one cause of low back pain, is lift twist injuries. So what that looks like is lifting and then moving your entire body when you're going to set something down, as opposed to just lifting and twisting your low back. That's when the injuries happen, is with the lift and the twist. So making sure that you're lifting properly in general, all the knees bent, back straight, all of that. But of course, then above and beyond, lifting without twisting unless you're rotating your entire body to set something down. Lack of movement in general is a huge culprit. Lack of resistance training, because of how it leads to weak musculature in the body, is a huge culprit for spinal and disc problems. An inflammatory diet is a huge problem. Dehydration doesn't get much more important than that. Disc degeneration, if you remember right, is disc dehydration. So if you're not drinking enough water, your discs can't get the proper hydration that they need. Let's move on to some simple things that you can do now to prevent and then improve spinal pain. So some of these have become my favorites over time with what I use personally, and then what I have seen with the thousands of patients that I have taken care of over the years. I'm a huge fan of inversion tables. Inversion tables, when used properly, and most inversion tables will come with instructions. Obviously, you don't want to get an inversion table and hang upside down for 15 minutes the first time you use it. But when you break into them slowly, when you use them properly, those are absolutely fantastic for taking some pressure off those low back discs and really stretching out the spine overall. Bar hangs are another really big one. They've become popular over the last 5 years, talking about doing like the dead man hang, where you're literally just hanging from a bar. And when you do that, it's not only stretching out your spine, but there's also studies linking that grip strength that you create from that to improved longevity over time. So many benefits from bar hanging. I recommend starting really slow. Some people can't even hang for 5 seconds. No big deal. You just work on whatever you have for your starting point. And then the goal would be, if you can, you get up to a 2-minute bar hang per day. Now, realistically, the majority of people can't get there. You just do the best that you can, but it's something that you want to work on a daily basis. Foam rollers. Huge fan of what are called foam rollers or yoga rollers. These actually probably became more popular when the Chirp Wheel company went on Shark Tank. So Chirp Wheels are a version of the typical yoga foam roll, but they're a smaller foam roll, so there's less surface area on your entire spine, and because of that, you get more benefit from them. They're also hollowed out, which is why I love them for traveling. You can put them in a suitcase and hardly take up any space whatsoever. We also have those listed on our website for convenience for ordering. I think you get 10% off. I recommend, they have many different ones. I recommend at a bare minimum doing the 4-inch and the 6-inch Chirp wheels. Both of those are fantastic. The 6-inch works better for the low, mid, upper back area, and then the 4-inch is great for the neck area. Sleeping posture is a really big thing. So for sleeping posture, ideal situation, which most people can't do admittedly, is sleeping flat on your back. So sleeping flat on your back with something supporting your neck curve. I'm not a big fan of the pillows that just have the rounded, contoured front edge if you're a back sleeper, because what they do is, yes, they support your neck, but they do that at the cost of pushing your head forward, creating more forward head posture, which is already a problem for the majority of people. So sleeping posture is ideal on your back if you're using a roll underneath your neck or using a pillow that has a cutout in the middle so that your head can sink all the way down to the bed. The second best position is on your side. Now, if you're a side sleeper, then it's perfectly fine and great to have one of those contoured pillows because it's still supporting this gap here in between the bed and the side of your neck. But then also, when you're sleeping on your side, what you don't want to do is curl up into the fetal position. When you do that, you're putting strain on your neck. You're also increasing that forward head position, which is so problematic already due to cell phone use. So you want to try to be in as neutral a position as possible, and then also have a pillow between your knees, because that's going to stop your pelvis and low back from twisting and rotating when you're in that position. Car posture is another really big deal. So especially for people that are truck drivers or spending a lot of time on the road for commutes or for their work. For car posture, there's a few things that I recommend. Number one, bare minimum, when you get in your car, you want to push your pelvis all the way back so it's hitting the back of the seat. And most people are pretty shocked they think that they're already doing this until they put conscious effort into it. The majority of people get into their car and just kind of sit down, and automatically, if you've got a couple inches in there between your pelvis and the seat, it's going to create a slouch, which is not what you want. When the pelvis is all the way back against the seat, you're going to be sitting more upright. From there, you want to have your lumbar support all the way out, so it's supporting that forward low back curve that we all have. And then this is the really tricky part for most people, is you want to have your head up against the headrest. So your head should be resting against the headrest. Obviously, you can't do that if your seat is really reclined. But if you start to become aware of this, you'll see when you're sitting at a four-way stop, you're sitting at a stoplight, as you watch the cars driving in front of you, you'll see person after person with their hands on the steering wheel and their head floating 6, 8, 10 inches out in space in front of them. That's the opposite of what you want. You want good posture, shoulders back, head against the headrest. If you incorporate those simple things with sleeping posture, car posture, it can make a tremendous difference on short and long-term spinal health. And then one more little nugget for people that are experiencing sciatic pain. If your seat has the ability to, this is the back of the seat here, if you raise the back of the seat up, the front of the seat down, so that your knees are lower than your pelvis, that will help take strain off your low back, take strain off the sciatic nerve, and for some people it can literally alleviate sciatic nerve pain. If your seat doesn't have the ability to do that, you can buy seat wedges on Amazon or in most auto parts stores. With that seat wedge, where it's bigger in the back, smaller in the front, is going to allow that same position to take pressure off the low back and the sciatic nerve. Computer posture. This is something that most people are aware of, but some basics is you want to have your keyboard at a level where your arms are in a neutral position, 90-degree angle, so they're not too far down, they're not too far up. You want to have the monitor dead center eye height to make sure that you're not looking too far up, and for most people, especially working on laptops, where you're not looking too far down. Cell phone posture. This one, really simple. I mean, most people are not going to sit with their cell phone like this all day long because your arms fatigue, your shoulders fatigue. So what you want to do when you're sitting with your cell phone is leaning forward, where you've got your knees, your elbows rather, on your knees, and keeping your spine and your neck in a neutral position instead of doing that, which is what most people do. They're looking straight down at their cell phone. From some of the medical literature on spinal posture and all of the detrimental effects of cell phones, we know that when you're looking straight down with your cell phone rested on your lap or on your stomach, it makes your head go from feeling like 10 pounds to 70 pounds. And then that is what creates forward head position, weak postural muscles, disc degeneration, and arthritis in the neck. So cell posture, sleep posture, car posture, computer posture, those things are all huge. And imagine if you're doing those on a daily basis, what a difference that's going to make in the long run. Hydration, we already talked about. To hit on that a little bit more, you really want to have 50% of your ideal body weight on a daily basis in ounces of water. So that would mean for somebody that has an ideal body weight of 200 pounds, they would want to drink 100 ounces of water on a daily basis. And for some people, that sounds like a tremendous amount, but really it just adds up very easily throughout the day when you're drinking it gradually throughout the day, which is what you want to do for proper hydration. When it comes to nutrition, unfortunately, the average person is eating the standard American diet. The initials of that is SAD. That SAD diet creates inflammation. We know when there's inflammation from your diet on a daily basis, it becomes chronic inflammation. That chronic inflammation leads to chronically inflamed tissues like your spinal discs, your postural muscles, and then you not only develop disc degeneration faster, but postural muscles get weaker, bones develop arthritis remarkably faster. I mean, inflammation, literally, if you look at the definition of arthritis, arth means joint, itis means inflammation. So chronic inflammation in the body leads to dramatic increases in arthritis throughout the spine and the rest of the body. So what you want to do is you want to eat a whole food diet. The Eat the Rainbow, incredibly important when it comes to fruits and vegetables. We're eating a wide variety of fruits and vegetables on a daily basis. You're getting a wide variety of different nuts and seeds on a daily basis. You're getting high quality proteins from grass-fed meats, from pasture-raised poultry, pasture-raised eggs. Ideally, all of those are organic as well. But if you simplify it, whole food nutrition, focusing on quality instead of quantity, that's going to go a long ways for reducing inflammation in your body, not only making your spine and your spinal discs healthier, but it's also going to create health through the rest of your body. When it comes to supplementation, I often talk about the foundational four, and the foundational four, incredibly important here as well. So we know that with a multivitamin, that's going to make sure that you're not missing any key nutrients that your spine and your nervous system needs. We know that with the omega-3 fish oils, it's going to help keep inflammation levels down. With things like spore-based probiotics, it's going to make sure that your gut is healthy, which means your immune system is going to be healthier, which is going to keep inflammation levels down. Vitamin D3 plus K2, which is the fourth of the foundational four, is vital for bone health and so many other things. And then above and beyond the foundational four, for somebody that's already dealing with a lot of disc problems, a lot of joint problems, Nutridyne, which is the primary supplement company that I recommend that we have on our website. If you click on the shop brands portion of our website, it's going to take you to a bunch of different brands that I recommend. The top one you're going to see is Nutridyne. When you click on that, you're going to see a bunch of tabs. If you click on the tab for bone and joint, you'll find Chondro Relief. Chondro Relief is a supplement that's amazing for somebody that's already suffering with disc degeneration or has had that diagnosis, and it's going to help keep those discs and joints as healthy as possible by giving them the nutrients that they need. And then there's also something that I do on a daily basis, two things that I do on a daily basis: Collagen Renew, which is collagen peptides from type 1 through 5 collagen. And then there's the multi-collagen, which is also type 1 through 5 collagen. So it's great for skin and hair and bones and nails and gut health and brain health when you're getting those multiple different forms of collagen. So what I do with those two things is I do a half scoop of each of them daily, mixed together, and it makes a fantastic, tasty, chocolatey shake, which I think is absolutely amazing. Injury and surgical support is the last supplement that I'm going to talk about. So this one, of course, by name, as you can imagine, is great for somebody that's had a spinal injury. It's great for somebody that's gone through a spinal surgery or about to go through a spinal surgery. It's really an extra strength formula with both bone and joint in mind. So it takes all of that into consideration. But it's not only good for somebody that has had an injury, for somebody that is going through a spinal surgery, but for somebody that has advanced spinal degeneration, advanced arthritis. It's amazing to do that on a regular basis to give your spine the support it needs. Even if it isn't going to rebuild it, you can slow down or hopefully stop those processes from continuing. I mentioned earlier, but I'm also a huge fan of things like massage, acupuncture, dry needling, physical therapy, stretching in general, anything you can do to help improve the soft tissue, the muscles supporting the spine and the rest of the body is going to be hugely beneficial for you long term as well. And we're going to end today with my favorite, and this I think should be your number one takeaway from this podcast, and it's something called spinal hygiene. So we'll have this up on our website, as well as a link in the show notes to a simple document on how you can walk through spinal hygiene on a daily basis. And really what spinal hygiene is just spinal range of motion stretches. I strongly believe that these spinal stretches are as important to your spine as brushing your teeth are to your oral hygiene, to your teeth health over time. And it's something that I think every man, woman, and child on the planet should be doing on a daily basis because of all the things that happen to our spine over time with our lifestyle. Spinal hygiene, you're just simply doing stretches that take your spine through a full range of motion. So you're going side to side on a daily basis. You're going forward and backward. You're rotating in both directions. The document will walk you through how to do that first thing in the morning. It'll walk you through how to do that right before you go to bed at night. And then also, hugely important to do before a workout, before you go for a run, before you do any exercise. Hugely important to do a few repetitions of it throughout the day after you've been doing some prolonged sitting or you've been sitting in your car for a long period of time. The spinal hygiene helps to hydrate the discs. It helps to keep the muscles looser. Looser muscles mean stronger muscles. It will make a tremendous difference not only in the health of your spine long term, but it's going to help you reduce low back pain, reduce neck pain and other spinal pain, even reduce things like arm and leg sciatic nerve pain as well. So here's the really cool thing about everything that we talked about today. Whether you're trying to prevent, improve, or heal from spinal problems and spinal pain, the same rules apply. Everything that we talked about today can help you prevent, improve, and heal. All of the same rules apply, but of course, the worse your spinal problems are, you just might have to put forth more effort. You might have to take the extra supplements. You might have to put more effort into your nutrition on a daily basis, more effort into your hydration. You may have to do more, but it absolutely will help your spine not only heal better and faster, but it's going to prevent things from getting worse over time. We're going to end with the inspiration and educational takeaways. Today, I have 3 of them for you. Number 1, success equals simple habits performed daily over time. And when we're talking about dealing with spinal pain, this doesn't get much more important than this. You have to look at it as a long game if it's something where you already have arthritis and degeneration. Doing those daily spinal stretches, improving your posture on a daily basis, focusing on nutrition, all of those simple habits performed daily over time are going to give you a better chance for success. The spinal hygiene exercises is the second takeaway. Don't take those things for granted. They might be simple, but simple doesn't mean that they're not effective. And there's a saying that I've heard many times, and I believe it's so true when it comes to spinal hygiene from what I see with my patients in my office, that the things that are simple to do are also simple not to do. So don't make that mistake. Incorporate those spinal hygiene stretches, hang them up on your fridge, put them on your bathroom mirror, somewhere where you're going to have that daily reminder to do them on a daily basis and ideally multiple times a day. Number 3, you are a leader. When it comes to simple things like spinal stretches, a perfect example of this is my kids won't let me go to bed at night or my wife go to bed without doing the spinal stretches. It's such a part of our lifestyle that they do them themselves in the morning. They do them throughout the day. They notice if they've had a little tablet time and their neck gets stiff, they go up or they stand up and go through their spinal stretches. They do them every night before they go to bed, and that's just a result of me doing them on a regular basis, my wife doing them, and you can do the same thing for your family. You are a leader. Somebody's watching. Children are watching. It doesn't get much more important than that. So if you enjoyed today's podcast and found it beneficial, I want you to think about who needs to hear this message. Drop them a text right now. Tell them to check out the Foundational Health Podcast with Dr. Kevin Schultz, episode number 10. Until next time, make health your hobby. Thank you for listening to the Foundational Health Podcast. As always, if you would like to learn more about making health your hobby, visit our website at foundationalhealth365.com and follow me on Facebook at Kevin Schultz DC Foundational Health.